Hi, good afternoon. You guys all set? Yeah, Jenny? You're good? Cool. All right, good afternoon. I'm Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. Today we are up to 887 cases in Utah. That's an increase of 81 from yesterday, which is just a 10% increase. What's really remarkable is that we've tested 18,518 Utahns for COVID-19. That was 2,510 people tested yesterday, and we're still maintaining about a 5% positive rate here in Utah. The governor did ask me to clarify that number. He mentioned a different number in his 11 a.m. briefing, but yesterday we did test 2,510 Utahns for COVID-19. Unfortunately, we do have a fifth death in Utah. It is a resident of Weber Morgan. They have released their own press release, but I do have a few details. It was an older adult, less than 60 years old, who passed away at a long-term care facility. That long-term care facility was able to take all of the appropriate precautions to prevent spread, and no one else in that facility has tested positive for COVID-19 yet. Central Utah Health District has also announced their first case. This is a gentleman who is over the age of 60 years, and he is recovering at home. This number will be reflected on our dashboard tomorrow, and so now we have a positive case in every single health district in Utah. I'll open it up for questions. Go ahead.
How many people live in the long-term facility that the person who died?
Sure. So the question is, how many people live in the long-term care facility that passed away? I don't know. Yeah.
Have all of them been tested?
No. So I'm not sure exactly who has been tested, but they would have tested everybody who had symptoms consistent with COVID-19 and had close contact with the individual, such as this person did have a roommate who was removed when the individual tested positive for COVID-19, but that roommate tested negative for COVID.
When did this person test positive?
I'm not sure of the exact date and timeline. Any questions from the phone?
Yeah, so the state...
Go ahead.
The state says that they want to get up to 7,000 tests a day. What's their plan to get to that number? And do that many people need to be tested, or do they just want the ability to test that many people?
So the question is, the state has announced that they would like to get to 7,000 tests a day, and what does that mean? Our goal here at the Department of Health is to make sure that everybody who needs to be tested for COVID-19 has the ability to be tested. And that includes people who have had close contact or potential exposure to somebody with COVID-19, or people who have symptoms consistent with COVID-19 without any potential exposure. And so that is our goal, to make sure that everybody who needs a test for COVID-19 can get one.
Some folks have a mobile test center, so are you going to be sending mobile test centers to folks who shouldn't leave their homes?
So the question is about, are we going to be sending mobile test centers to people who cannot leave their homes? So our testing infrastructure currently relies upon our healthcare systems, who have set up alternate specimen collection sites that allow for providers to conserve personal protective equipment while also keeping themselves safe and testing as many patients as they possibly can for COVID-19, and being very efficient at that. And so we are working directly with all of our healthcare systems to get that in place statewide, so that there is access across Utah for that. Go ahead.
Last week there were about 700 people or 800 people a day getting tested, even though there was a capacity for more than that. And you said that there just weren't that many patients seeking testing.
Yeah.
Is that still the case, that there are fewer patients seeking testing than the state has capacity for?
So the question is about demand for testing. With the rollout of our alternate specimen collection sites with our healthcare partners, we have seen a jump in the number of people getting tested. Yesterday was our highest increase in the number of people being tested in Utah, with over 2,500 people, and that's huge. And so we just want to make sure we continue to have the capacity to meet the demand that is out there.
And when you say that 2,500, is that the number of tests that the results have been returned for? Or
Yes.
the number of people who have gone through and...
Perfect. Thank you for clarifying. So the 2,500 number is the number of results we received yesterday. And so that we get negatives, but the negative results are a little delayed. And so that's reflected of the number of people who got their tests probably 2 or 3 days ago.
And so as of yesterday, was anybody being denied a test?
So as of yesterday, the question is, has anybody been denied a test? So our current guidelines include anybody who has symptoms consistent with COVID-19 can be tested. So I'm not sure if anybody out there has specifically been denied, but we recommend that anybody with symptoms get tested. Go ahead.
Dr. Dunn, how are you on the flattening of the curve, as it were?
Okay, hold on the phone real quick.
You see this jump in testing, you see the number of positive cases, only 5% coming back positive. Where are we at with the curve?
Yeah, so the question is kind of where are we at on the curve, and we continue to see promising numbers that give us hope that social distancing is working and give us evidence that it is working, given that our rate of increase has been decreasing. And even though our testing has increased, our positive rate still maintains at that 5% or lower rate, which is really good. However, when we talk about flattening the curve, just having a few days trend of data isn't enough to give us any really concrete evidence. We need to go at least 1 to 2 weeks before we can make good assumptions because of the 14-day incubation period of the disease. So all of the signs are really good that social distancing practices are working. Our public health departments are doing an excellent job in terms of identifying people who come into close contact with positives and making sure they stay at home. So our system is working, and we just need to continue those efforts moving forward to continue to see the decrease in the rate of cases. On the phone?
I know. Yes, Dan Ransco with PSL TV. I know some of those tested just this morning, and they were told that it would take 5 to 7 days for results. That just seems very high.
Yeah.
Is that because of the large number? Why so long of a time for results?
So the question is, how long do results take? If somebody gets tested and their specimen is sent to a lab in Utah, so at ARUP, Intermountain, or Utah Public Health Laboratory, the turnaround time is 24 to 48 hours. However, some providers are sending specimens to LabCorp and Quest, which are national laboratories, so they get sent outside of the state of Utah, and those tests take about 5 to 7 days, and we don't have any control or visibility on the process with LabCorp or Quest.
The 73 hospitalizations.
Another quick question, if you don't mind.
Sure.
Those family members that do find somebody sick at home, what advice or counsel do you have as far as what should home life be like for those who have somebody that's sick at home?
So the question is about, if you have someone sick in your household, what would life be like? We do recommend that if there is an individual who is ill in the household, that whole household stay home until everybody in the household feels better and their symptoms have resolved. And that's because there is such, a high likelihood that close contacts to an ill person become ill themselves. And so it's prudent to prevent the spread of COVID-19 that the whole household stay quarantined until everybody's healthy. Go ahead, Erin.
Another question.
One moment, just a question in the room real quick first.
The 73 people that have been hospitalized,
Sure.
are those people who are in the hospital now, or is that the number of people who have required hospital care that you're aware of since the beginning of the...
Yep. So we have 73 people who have required hospitalization since the beginning of the outbreak, not currently hospitalized. Okay, on the phone?
Yeah, so where do we stand on temporary hospitals and making sure we have enough beds and space for patients as cases and hospitalization rises?
Sure. So the question is, where are we on increasing our capacity to be able to provide medical care for those who need it in a hospital setting? So right now, our numbers are actually looking very good that if we maintain this rate, we won't see a huge strain on our healthcare systems that we were predicting earlier. However, we are preparing for the possibility of a big jump in cases because we always want to prepare for, that possibility and make sure that we have things in place if we do have a surge of patients. And so our preparedness team is working very closely with the Division of Emergency Management to ensure that we have options beyond traditional hospitals to care for patients. So I don't have those specific numbers on me today, but those plans are in the works for those kind of alternate settings.
Yeah, and then going off of that, masks. So we've been hearing there's a possibility that the CDC could start recommending people wear face masks in public. If that happens, how will the state help facilitate and implement that? Is that something you guys are considering?
So the question is the CDC or are we starting to consider face masks for the general public? And to my knowledge, there hasn't been any conversations on that level, definitely not at the state and not at the national level at this point for wearing face masks in communities where there is not widespread sustained community transmission. So in Utah right now, we aren't at the point where face masks for the general public would help prevent the spread of disease. Go ahead.
Dr. Dunn.
Why is that?
Okay, sure. So so why don't we allow, or why don't we recommend face masks for the general public? So face masks, the surgical masks that people might see others wearing out, are just to protect an ill person from spreading it. So if you have a cough or are sneezing a lot, if you wear a face mask, you're less likely to get your germs on other people. A face mask does not prevent germs from getting on you. So if you're healthy, it won't protect you. All it does is prevent your germs from going elsewhere. So in a situation like Utah, where we don't have widespread community transmission, there isn't any evidence that wearing face masks, if you're well, prevents you from getting sick. I hope that was clear.
Thank you.
Yeah, sure.
Dr. Dunn, just the Department of Public Safety Commissioner suggested that in his briefing this morning that there might be the possibility of quarantine sites as they transition to a level 1 emergency. What does that entail? What does
Sure.
that look like?
Yeah, so the question is about quarantine sites. So again, we're always preparing for kind of one of the worst case scenarios where we have a huge increase in cases of COVID-19. And the way to prevent the spread of COVID-19, as we know, is to be quarantined and be away from people who are not ill so that you can recover without spreading it. And an option for that is having quarantine sites especially for people who don't have the ability to be quarantined alone or to be isolated alone while they recover. And so we're doing everything we can as a state to make sure that anybody who is ill or who has come into close contact with someone with COVID-19 has a secure space for them to recover without spreading it to other people.
But you have no
Couple
need for that
questions on the
yet
phone.
then.
Yeah, so currently we don't have a need for that. We have been fortunate here in Utah that everybody identified has been able to either self-quarantine or recover at home or potentially in a hotel room. So some of our local health districts have secured hotel rooms where people who have been exposed are able to quarantine and prevent spread to the community as well. Okay, on the phone?
Yep, Dr. Dunn, thanks for... Oh,
Go ahead.
Dr.
That's so
Dunn,
hard.
Keith Ewing from Channel 4 News. Thanks for everything that you and your team have been doing lately. I had a couple of questions for you. First one is there an update on ventilators and how many the state has? Or are you able to share that information yet? And the other question that I had is, is the Department of Health in talks with hospitals about crisis triage officer teams and how that will be implemented if we start to meet capacity at hospitals?
Sure. So the first question is about ventilators. The Department of Health, in conjunction with the Department of Public Safety, is working very closely with all of our hospitals to get an accurate count of statewide capacity for ventilators. We do not have that number yet, but we are working with all of the healthcare systems to get that and be able to share it with you all. The second question was about crisis standards of care and allocation of scarce resources if we do get a surge of patients needing hospital care. And we have a group of experts that is representative of all of our hospitals, our healthcare systems, and the Utah Hospital Association, working with public health to come up with a plan on how we will allocate resources if we do get to that point. So they're in talks, if not daily, several times a week, determining what that would look like here in Utah.
So are there teams in place at hospitals yet, or are they still in discussions about compiling those teams?
So are you talking about teams to allocate resources?
No, I'm talking about teams that would ultimately have to decide patient care and using the patient prior to
Sure.
patient tool.
Sure. So that is going to be a statewide effort. So we're really committed to having a coordinated statewide policy moving forward on all things COVID-19, but especially with triaging patients and where they can get the care they need. Currently, all of our healthcare systems are able to handle the patients that come into their hospital right now, so we haven't had the need to activate those teams, but it will be a statewide coordinated approach with all of our hospitals participating in that.
Thank you.
Dr. Dunn,
Yeah.
given that there is now every single local health department is reporting a case of COVID-19, are you still readdressing whether or not a statewide stay-at-home order is needed, necessary, or unnecessary?
The question is, now that we have 13 health districts, each one reporting at least one case of COVID-19, are we thinking about a statewide health order? So those decisions are made at the governor's office. We as a public health department provide the governor's office with the best evidence and interpretation of the data as we see it. And then they take that into account with the other impacts of a stay-at-home order, such as economic and others, to make their final decision. I think the governor's recommendation for a stay-at-home order speaks to that and puts the responsibility on individuals to know what's appropriate for them in their communities and allows the local officials to make those determinations. And there have been several health districts throughout the state that have issued their own kind of more stricter orders versus a recommendation.
Dr. Dunn, follow up on that question. The governor said the next 2 weeks are critical. So from a health standpoint, would it be more effective for the entire state to be on the same page instead of individual cities or counties implementing their own guidelines? Or does that not really matter?
So the question is, would it be more effective to have a statewide, basically stay-at-home order, consistent approach? I mean, there is definitely evidence in public health epidemic response that statewide approaches work, but we do recognize the variety of situations going on across our state, from urban districts to the more rural districts in terms of density of people and cases. And so I think that's why the governor has left it up to the local jurisdictions to determine what's best for them.
But would it be more effective if everybody was on the same page? Like, would we flatten the curve a lot faster if everyone was on the same page?
Yeah, so I mean, again, it's hard to predict. The question is, would we flatten the curve if everybody was on the same page? It's really hard to predict what the best policies are to impact this pandemic because it is a novel coronavirus. We do know that it is important to have consistent messaging out there, and I think that consistent message of stay home if you can and only leave if you need to access critical services is really important. And then especially for our more vulnerable populations, being even more adherent to that is super essential. So it is important to have that consistent message across the state.
The health department recommended
Dr. Dunn, do you have any evidence of false positives or false negatives from testing? And second question,
I have to remember 3 now.
Healthcare workers have contracted the disease or been hospitalized for COVID-19 at this point?
Okay, I'll get to that in a second. The first question was, has public health recommended a statewide? Yeah, so we have provided recommendations to the governor's office about the benefits of a statewide stay-at-home order. Yeah, and then the question from the phone, okay, you'll have to correct me if I'm wrong. Do we have any evidence of false positive or false negative tests? So we at a state level do not, and I think that's something, or I know that's something that scientists are working on a national and international level to understand the rate of false positives and false negatives with this new test. We do know that it is most effective and most accurate in symptomatic people, and that's just because if you have symptoms, you have a lot of virus in you at that point. And so somebody who's symptomatic who gets the test, we have a lot of confidence in that result. And what was your second question?
If any healthcare workers have contracted the disease or been hospitalized for it?
So we do have a few healthcare providers who do have COVID-19, and we don't know the exact source of their disease. So they could have got it in a healthcare setting, but we're not sure. They could have also got it in their daily lives in the community. But we do not have any healthcare worker who has cared for a known COVID-19 patient who has contracted it.
How many healthcare workers have?
Is there a protocol in place if an employee?
No, it's okay. They can't hear you. That's fine.
Service contracts COVID-19, say someone at the grocery store?
Okay, one moment.
How many healthcare workers have tested positive?
How many healthcare workers have tested positive? We don't have the specific numbers on healthcare workers separated out by profession at this point. What was the question on the phone?
Yeah, just if the Department of Health has a protocol for employees that may test positive for COVID-19 at an essential business, say, someone at a grocery store, what does that grocery store do if that happens?
Yeah, so the question is, if somebody at an essential employee tests positive for COVID-19, what do we do then? It's the same thing we do for all of our positive cases. So public health, our local health departments will reach out to that individual who tested positive and identify all of their close contacts, and also talk with the owner or the manager of the business to recommend cleaning practices depending on the type of business and when the person tested positive. So we work directly with the businesses and the individual who tested positive to eliminate spread to the general public and people going into that business afterwards.
Doctor, do you
Yeah.
know how many long-term health centers have confirmed cases?
Sure. So the question is, how many long-term care centers have cases? I don't have the exact number off the top of my head, but it is just a few. Like, we've only had, I can try to think, a couple, so less than 3 that have had actually confirmed cases in the long-term care setting, and that is essential. I mean, we know that that is our most at-risk population, so our facilities are doing an excellent job in terms of screening visitors and the healthcare workers and not allowing sick people in there that could possibly spread COVID into that vulnerable population. So we're doing really good on that front. Okay, guys, thank you so much for your time. Oh, go ahead. No, it's okay. I should have paused longer.
We learned from the governor this morning that there is a new person at the head of the health department.
Yeah.
Can you tell us what is his role going
Sure.
to be? What will he be doing?
Sure. So General Burton is going to be taking over temporarily the lead of the Utah Department of Health. I haven't had an opportunity to meet with him yet, but I expect to do so in the coming hours, and we'll figure out kind of exactly what his role is going to be with regards to the health department as a whole, and specifically the COVID-19 response.
Have you been told, are your duties changing at all?
No, we haven't done that at all, so I think this afternoon we'll have the opportunity to do that.
When did you first learn about this staffing change?
At the same time you did.
Okay. And now, can you tell us what happened to Dr. Miner?
Sure. So Dr. Miner's health is definitely our priority right now. He is in a vulnerable population for COVID-19. So with all of the things going on at the Utah Department of Health, especially with the pandemic, it was determined by the governor's office that it's best to have someone who's physically able to be here and not be at risk health-wise. And so Dr. Miner's doing fine. He's at home, but just protecting himself against COVID-19.
Okay. My understanding is that General Burton doesn't have a background in medicine or public health. I guess, can you tell us how you feel about the health department being led by somebody without a background in public health or medicine?
Sure. So, I mean, I haven't met General Burton, but I am really excited to work with him and learn about kind of his vision of where we're going to go in this pandemic and how we can best support the statewide efforts going on. So I reserve kind of any judgment before I meet him. Okay, guys, thank you so much for your time. I appreciate it. Yep.